Welcome to our exploration of Cpt Anesthesia, where we shed light on critical codes that ensure precise investment and documentation for anesthesia care. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will delve into unlocking the secret of anesthesia CPT with an in-depth discussion of each code meticulously designed to equip you with the knowledge needed for precise and efficient medical coding. Without further ado, let's start a journey to explore more about CPT anesthesia. Anesthesia chapter is basically divided on the basis of anatomical site, radiological procedure, burner excision or deprivement, obstetric procedure, or the other procedure. In this video, we will cover first two anatomical site, head and neck. Let's start from the head, the first anatomical site of the anesthesia chapter. First code is 00100, anesthesia for procedures on salivary glands, including biopsy. It means the provider administers anesthesia service for a patient undergoing a procedure on salivary gland located in the mouth, which may involve extracting a small piece of tissue or cell from the person's body for diagnostic purpose, which is also called biopsy. Next code is 00102, anesthesia for procedures involving plastic repair of cleft lip. It means the provider performs anesthesia service for a plastic repair of split or separation in the upper lip resulting from incomplete vision. Next code is 00103. Anesthesia for reconstructive procedure of eyelids, for example, blepharoplasty, ptosis surgery. It means the provider performs anesthesia service for procedure done on eyelids like repairing of eyelid, also called blepharoplasty, tightening the muscle of the upper eyelid, also called ptosis surgery. Next code is 00104, anesthesia for electroconvulsive therapy. It means the provider performs anesthesia service for the treatment that involves sending an electric current through brain. Next code is 00120, anesthesia for procedures on external, middle, and inner ear, including biopsy, not otherwise specified. Code 00120 is a parent code of code 00124 and 00126. Always remember that code like 00120 with descriptor not otherwise specified is used when the documentation provided by the physician does not provide enough information to assign a more specific code, or when there is not enough documentation to select a more specific code. Next code is 00124, otoscopy. Oto means ear. Scopy means observing using a specific tool or device. Otoscopy means the provider performs anesthesia service for looking and observing inside the ear using a specific tool or device. Next code is 00126, tympanotomy. The tympanic membrane is also called eardrum or myringa. It is the part of the middle ear, and otomy means cutting into or incision. It means the provider provides anesthesia service to facilitate surgical access to the middle ear and structure for diagnostic purposes. Next code is 00140. Anesthesia for procedure on eye not otherwise specified. Code 00140 is a parent code of code 00142, 00144, 00145, 00147, and 00148. The code 00140, again with descriptor not otherwise specified, indicates that there was not sufficient information provided to specify the exact eye procedure for which the anesthesia was administered. Next code is 00142 lens surgery. It is also called cataract surgery done on the lens of the eye. Next code is 00144 corneal transplant. It means the provider administer anesthesia service to facilitate a surgical procedure aimed at removing all or part of a damaged cornea and replacing it with healthy donor tissue. Next code is 00145 vitreoretinal surgery. This means that the provider administers anesthesia services to treat eye problems involving retina, macula, and vitreous fluid. Next code is 00147 iridectomy. Ectomy means removal. It means that the removal of part of the iris. The provider provides anesthesia services to remove the part of the iris. Next code is 00148 ophthalmoscopy. This means that the provider administers anesthesia service to facilitate examination of the back part of the eye, which include retina, optic disc, choroid, and blood vessels. Our next code is 00160 anesthesia for procedure on nose and accessory sinuses not otherwise specified. Code 00160 is a parent code of code 00162 and 00164. And all these codes are for anesthesia service given for procedures done on nose. Our next code is 00162 radical surgery. It means the provider performs anesthesia service to facilitate the removal of the organ affected by a disease along with nearby tissues. Radical surgery is mostly used in case of cancer. Next code is 00164 biopsy soft tissue. It means the anesthesia service is given for the procedure involving the extraction of small piece or tissue for the diagnostic purposes, which is also called biopsy. Our next parent code is 00170 anesthesia for intraoral procedure including biopsy not otherwise specified. The codes 00170, 00172, 00174, and 00176. These codes are for procedures take place inside the mouth. Code 00172 is for repair or cleft palate. It means the provider performs anesthesia service to facilitate the repairing of split in the roof of the mouth. Next code is 00174 excision of retropharyngeal tumor. Excision means removal. Retro means behind. It means the provider performs the anesthesia service to facilitate the removal of the tumor behind the pharyngeal region. Next code is 00176. It is again the radical surgery. Our next code is 00190. Anesthesia for procedures on facial bone or skull not otherwise specified. In this code, the anesthesia service is provided for the procedure done on the bones of face and brain. Code 00192 radical surgery, including prognathism. In this code, the provider administers anesthesia service to facilitate the surgery of prognathism, which is a condition of bulging out of the lower jaw, which is also called mandible, causing the lower teeth to extend beyond the upper teeth. Our next code is 00210 anesthesia for intracranial procedure not otherwise specified. Code 00210 is a parent code of code range 00211 to 00222, and these codes are used for anesthesia services for procedure done inside skull. Code 00211 is craniotomy or cranectomy for evacuation of hematoma. Craniotomy means surgical opening of skull, and cranectomy means removal of a portion of a skull. Hema means blood, and hematoma means blood clot. It means Anesthesia service is given for surgical opening or removal of a portion of a skull for removal of the blood clot. Next code is 00212 subdural taps. It means the provider administers anesthesia service for a patient undergoing a procedure to remove excessive fluid buildup in subdural space of the brain. Next code is 00214 Bull holes including ventriculography. Bull holes mean small holes. It means anesthesia service is given for making small holes. Include process in which X-ray is taken after the removal of cerebrospinal fluid from the ventricle of the brain and injected suitable contrast media to diagnose the central nervous system abnormalities. Our next code is 00215 cranoplasty or elevation of depressed skull fracture extradural simple or compound. It means anesthesia service is given for repair or resampling of a broken bone or fragments of skull. Next code is 00216 vascular procedure. It means the service is provided to treat the range of blood vessels problem. Next code is 00218 procedures in sitting position. Our next code is 00220 cerebrospinal fluid shunting procedure. It means the provider administers anesthesia service to drain excess cerebrospinal fluid from the brain and send it to the other parts of the body through a shunt, which is a hollow tube. Our next code is the 00222 electrocoagulation of intracranial nerves. It means the anesthesia service is given to stop bleeding using an electric current during surgery or after an injury. Next anatomical site of the anesthesia chapter is neck. The first code is 00300. Anesthesia for all procedure on integumentary system, muscles and nerves of the head, neck and posterior trunk. Integumentary system includes skin, hair, nails and glands. Next code is 00320. Anesthesia for all procedure on esophagus, thyroid, larynx, trachea, and lymphatic system of neck, not otherwise specified, age 1 year or older. In the parenthesis, there is an instruction for procedure on cervical spine and cord, see 00600, 00604, or 00670. Our next code is 00322, needle biopsy of thyroid. Next code is 00326, anesthesia for all procedure on larynx and trachea in children younger than 1 year of age. There is an instruction in the parenthesis, don't report 00326 in conjunction with 99100. It means the code 00326 is a combo code and it includes the information regarding age. So we don't need to put an additional information regarding age. Next code is 00350. Anesthesia for procedure on major vessels of neck not otherwise specified. Code 00352 is simple ligation. Ligations mean tie off. It means the anesthesia service is given to tie off blood vessels so that blood cannot flow to a part of the body or a tumor.